WI and the ministry and like as well. So let's move on. And this year we were very intentional about making sure that our youth was heard during this event. We've actually put them last on the agenda because we think it's so very important as we're moving into a new generation that we highlight what that looks like and the local leaders that are taking the charge and making sure that Bermuda gets stronger and stronger in terms of being a mentally friendly environment. So our next speaker is another powerful young youth-led mental health voice here in Bermuda. His name is Christopher Jackson, and he is the chairman of the Bermuda Youth Advisory Board, which is a youth government body advancing youth mental health, the Youth Mental Health Plan 2027. So, like, how cool is that? He's also currently a grad student in psychology, which I love, and with a frontline experience across institutions like Soldier. I'm so sorry. So sorry. Call came in, unfortunately, but let's get back to it. Across institutions like SOLTIS, Bermuda Hospital Board, the Department of Child and Family Services, and Autism Behavioral Clinics in United States. Christopher has designed national debates on consent reform, produced podcast series, and led anti-stigma campaigns, all with one goal: to embody youth voice in policy, practice, and long-term mental health legislation. He is here today to close us out with the conversation that is as urgent as it is inspiring, rooted in lived experience, research, and a commitment to system changes. Please join me in welcoming Christopher Jackson to the virtual stage.
Thank you for such a wonderful introduction. That really blew me away. I didn't know it was going to be like that. Just wanted to say thank you to the Bermuda Mental Health Foundation for hosting an event like this. It's truly inspiring just to see all the different types of presenters all coming together to present on one goal. And I think that as it was previously stated, that this conversation is really, really important. And I'm just I know it's the end of the day, so I'm not gonna ramble on too much. So I'm just gonna try and get into it as quick as possible, but also understanding that this is a really important aspect to mental health in Bermuda, and it's the youth aspect of Bermuda. So again, my name is Christopher Jackson. I am currently the Youth Advisory Board Chair, as well as a master's clinical psychology student. And I'm just basically gonna go through a bit of a timeline of building the Youth Advisory Board in Bermuda, what it means, what it stands for, what it was built on, and some of our current goals that we're working towards for this year. So without further ado, I will pull up my presentation. So that's not the beginning. There we go. Building the Bermuda Youth Advisory Board. Our slogan that came up through one of the debates that was previously mentioned is "Nothing about us without us." And our whole goal is about empowering young voices to transform mental health systems in Bermuda and beyond. And so before I even go into what the Youth Advisory Board is, I just want to give some brief context on the scope of mental health and what the Youth Advisory Board is moving informed of. And so in 2022, Dr. Daniel Kavanaugh, who will have an amazing presentation tomorrow that I encourage every one of you guys watching to attend in person, he conducted a 2022 National Adolescent Mental Health Survey, which revealed urgent needs among Bermuda's youth. Basically, it showed that we were demanding immediate and inclusive responses. So I'm not going to go into too much detail about the statistical findings, as Dr. Daniel Kavanaugh will go into that tomorrow. But the key main pieces were that 31% of young people reported depressive symptoms, 25% reported anxiety symptoms, and 20% reported both. That's a lot of statistical numbers. I know sometimes it's hard to conceptualize what these things actually mean. But if you don't take any of this away with you, I just want you to take away one key statistic, and that is that these prevalence rates are 5 to 6% higher than global averages. And so it just really highlights the fact of what we already know, is that this is a major problem. Through these statistical findings, the Youth Mental Health Plan was created, which is basically a list of recommendations put forth by a research working group, Dr. Dan and his team, that are focused on mental health prevention, early intervention, stigma and mental health promotion, accessible services, and research and policy. Now, on this plan, again, I won't go into as much detail as Dr. Dan will tomorrow, but one key thing to look at is, it doesn't say forming a youth advisory board specifically on this document. But one of the things and one of the key words that are planted throughout this entire document, for example, recommendation 1A, target success criteria 2A, it's the word co-design. And the idea of co-design is basically ensuring that the services or whatever is trying to be implemented in any space is done so in a collaborative way where those that the organization is trying to treat are included in the decision-making and implementation process. So because this is a youth mental health plan, we have to ensure that youth themselves are involved in the implementation of the youth mental health plan itself. And so this is basically just highlighting what I just said. And so in terms of why does this matter, there's a big idea amongst, I would say, Bermuda and other jurisdictions that young people aren't experts in any field about anything because they're so young. So why does it matter for young people to have true power in decision making and the implementation of these things? Well, first of which is that while older adults may be well versed in different scientific research, different clinical practices, and other different expertise, they aren't experts in being young people in 2025. And so they can come up with a bunch of different ideas and ways to implement things, but who's to say that it will actually connect and have lasting power with young people themselves, which is why the idea of co-design, co-leadership, and co-production, where youth and adults partner equally, is so fruitful because it combines adults, experiential expertise through years of study, as well as young people's expertise in actually being a young person and going through some of the things that they go through in real time. And so the Youth Advisory Board ensures that young people have direct and continuous voice in shaping mental health systems. So a bit of a timeline. I know we only have a brief amount of time, so I just wanted to highlight some key things in terms of our journey from start to where we are now, to the launch of the Youth Advisory Board. So I mentioned earlier, from 2022 through around 2024 was a lot of the foundational research coming together, pulling together a lot of, I call them smart people in Bermuda. That's government bodies, education leaders, mental health leaders, to put together the Youth Mental Health Plan. And also, I wanted to preface as well, during that time, I was not a part of the Youth Mental Health Plan. I was a young person doing my undergrad in psychology, but also trying to figure life out myself, going through my own mental health issues, which I would want to preface that, I am someone who has my own mental health issues outside of my clinical expertise. And so during that time, the research was being done, being formulated, being put together. And I was really just any other young person in Bermuda trying to figure things out. In about March of 2025, through the Youth Mental Health Plan, looking to start a Youth Advisory Board, I was reached out by Dr. Dan Kavanaugh to be a part of the team. And in one of the first weeks of me being on the team, he called me, he was like, hey, we're going to this conference. It's all the way in Vancouver, and we're just going to learn a bunch. So not quite the typical onboarding process, but I will say it was very fruitful in terms of me learning international expertise in terms of youth advisory boards, co-production, and governance bodies, and how they truly work. And so from March, we came back to Bermuda in the spring, and right around the corner was May 2025, which was the Ministry of Health's Anti-Stigma Month. And we set out to make a working group to use some of the learnings from the international conference and put together a working group to try and support the Anti-Stigma Mental Health Month. And so one of the key recommendations that came out of that international learning was involving, community stakeholders. And so in forming this youth advisory working group, I basically called a bunch of mental health practitioners that I knew, some old teachers that I knew, and basically just tried to get as diverse of a group in a room together. And as you can see in this picture, here we are in our first working group meeting. This working group was focused mainly on supporting the Anti-Stigma Month. And one of our biggest events that we put on was through, it was a partnership actually with the Youth Advisory Working Group and the Ministry of Youth, Seniors, and Social Development, which was a debate that debated the topic of legislation, particularly mental health legislation in Bermuda, and the legislation barriers that you face in accessing mental health care and reducing the age of consent from 18 to 16. This event was highly successful. It was recorded by CITV. Initial analytics showed that over 500 people watched, and it was really just a bowling ball effect to see how, it was then presented at mental health forums. There was a legislation working group formed out of it, and the conversation just continued to blossom. So that was a great success coming from the Youth Advisory Working Group. From the Youth Advisory Working Group, moved on into planning and recruitment to actually start in the Youth Advisory Board. And again, using those international learnings of connecting with already established youth programs. Dr. Dan and I went around to several youth summer programs to basically present and pitch the idea of joining the Youth Advisory Board. Some of them include Mirrors, which is the picture you see here. Others include Future Leaders, Skillscraft internship program. We had several radio interviews. We did an interview on the Daily Hour. And with this recruitment, we received over 50 applications across Bermuda. And then 23 students from 9 schools were carefully selected through the application process, which brings us to where we are currently. On September 27th was our official launch in the Youth Advisory Board at Bermuda College after comprehensive orientation, members agreements, and wellness support systems put in place. So with that brief context put in, it was launch day, a new beginning. And we actually had Dr. David Sam, the president of Bermuda College, present with us on our first board meeting. And he gave a little quote and saying, by centering youth voices, we're investing in healthier, more empowered Bermuda. So given that I was able to go through a bit of the context of the Youth Advisory Board, I wanted to dive a little bit deeper about the theories and frameworks that guided our planning and our work to operationalize the Youth Advisory Board. So before, I mentioned the Youth Mental Health Plan, and I also mentioned that the working group was very, very, very stigma focused, anti-stigma campaign focused. Following the stigma campaign, we were in meeting rooms questioning, so what do we focus on now? Going into launching a Youth Advisory Board, what's the main focus? We have the information from the Youth Mental Health Plan, and given that we have that information, it really guided a lot of what we're focusing on today. And given that one of our biggest events was the national debate around legislation change, we decided that policy advocacy and the reduction of barriers to youth mental health and reducing the age of consent for mental health services was an easy follow-up for us to focus on in terms of our specific goals. The other one was social media and outreach, given that young people receive a lot of information and context of the wider world through social media, myself included. I am a young person. I know how it gets. And so we wanted to focus on being able to provide healthy messages and healthy outreach campaigns through those media to get the message out there. And then the third one, school health promotion committees. At the time when we were planning, it was one of the key pieces of the youth mental health plan that was sort of underdeveloped and needed a bit of momentum. So we thought that having a youth body helping that are actually in schools and have access to all the teachers, they know what it's like to be in schools. We thought it was a good idea to focus on this as well. Outside of those specific goals tied to the youth mental health plan, we also have the ladder of participation. During the international conference in Vancouver, I was introduced to the Organization of Origin, which is Australia's National Institute of Excellence in Youth Mental Health. And they've provided several research articles, frameworks, toolkits in terms of how to build youth participation. And so it's adapted from Hart's model, where it's a ladder of participation ranging from coercing all the way to co-designing. We are aware that not every youth participation or program can be the gold standard of co-designing, but we also understand that, it's about building the framework, where right now we may be more at informing, educating, consulting, with a goal of moving towards engaging and co-design in the future. So this is just basically what I just said in more specific context. The other piece that sort of governs our operations is, which those in the audience might be a bit more familiar with, is Centennial's youth engagement outcomes. They've provided extensive resources in terms of guidelines for youth engagement, those of which being youth organizing, youth civic engagement, and youth leadership, as well as all combining to promote youth development. And so I won't go into the specific explanations of each one due to the basics of time, but these are some key values that are pinned in our operations as a youth advisory board. So with those frameworks, we do our best to track youth power. So it's not just me saying that we do these things in presentations, but in the future, we'd be actually to show real data and outcomes of what we've actually achieved within this framework. So, our goal areas for meetings are logged, our outcome domain, whether it's in leadership. For example, in our second board meeting, we had the Minister of Education come in and consult with youth advisory boards about social media use or phone use in schools and get their insights. So all of that is logged, the ladder level, the participation depth, quantitative metrics, and qualitative insights. The one last evidence-based piece that we thought to implement as well was through this newly published article about evidence-based youth safeguarding. Mental health is a heavy topic sometimes, so we wanted to ensure that our structures and skills were in place to best safeguard the youth advisory board members. These are the guidelines that are set out in this publication, and these are some of the operational pieces that we implemented in order to align with that publication, which was clear agreements. All youth advisory board members signed consent forms that laid through their key agreements, role descriptions, and safety protocols. The other big piece was wellness planning. So when we were in the onboarding process, youth advisory board members created personal wellness plans with ongoing support, as well as another big piece, which is fair compensation. So our board members actually are paid for the time that they're given to us, and it's important to show that they are supported financially as well as emotionally. The other piece was partnerships with Mayor's program, keeping ongoing communication with parents and school counselors to provide continuous care and wraparound support. So these are some of the things that we implemented into our operation to align with evidence-based practices. And so this is just a cool diagram showing how specifically our youth mental health plan goals flow with one another and impact in totality youth mental health transformation. So policy work changes systems, school health promotion committees change schools, campaigns change minds, and together they create comprehensive transformation. So I did a lot of context building. I showed you how we've gotten to where our official launch day was. And so we do have some key achievements that we've been able to accomplish in our short time as a youth operating board. The first of which was a very amazing leadership and building advocacy skills training. One of the key things in our learnings from the international conference was that, if we're going to run a youth board, there has to be some sort of personal development involved with it. So Tim Spicer from Pair Forward, he is an international trainer. Pair Forward is a youth activation organization. Tim is a youth activation expert, and we were able to have him come in to do a very, very comprehensive and very fruitful training for our youth advisory board members. So they were crafting personal narratives with emotion and evidence. They were creating advocacy elevator pitches. They were designing mini campaigns for schools and breakout groups. They were presenting their I stand statements, basically explaining why and what they stand for. And so this was a really big achievement because the feedback was very positive from the young people themselves. Some other major events and milestones was the Mental Health 101 workshops that Dr. Dan and I basically gave as more training. The Chat Safe campaign was another big piece. Chat Safe is under the organization of Origin that I mentioned earlier. And what it is a set of guidelines that basically lay out safe communication and being safe online and on social media. And it's globally one of the first research-based guidelines that have been exported to the world. And youth advisory board members got a chance to receive those guidelines and get training, and then co-design some social media content that promotes these guidelines to put into the atmosphere. That was another big milestone. The other one was the Youth Mental Health Summit, which was over 200 students that gathered for breakout sessions. And YAB members actually opened this event and gave context to what they've been working on, as well as during that same week, there were youth mental health pledge sign-ins by principals at various schools. I didn't mention the pledges as much, but basically we set out a pledge to have schools basically sign up to be survey ready for 2027. The other one that I previously had mentioned was the age of consent policy debate. This was during the Youth Advisory Working Group. It was co-led with the Ministry of Youth. They drafted statements and engaged in a highly fruitful debate with over 500 people tuning in. And the other one was there are loads of media presence and public speaking roles. So we had young people on radio stations giving quotes and press releases, on podcasts. We had a youth advisory board open up the legislation panel that we hosted. And so the idea is to just promote youth voices as much as possible. Outside of, these are some of the pictures from the different milestones that we've achieved. So in the top, we had a podcast with two amazing youth advisory board members with Jeremy Deacon and the News Navigators podcast, which is also released now. We've had speakers at openings to the town hall for the social media and self-harm violence town hall. These are some youth advisory boards at the Youth Mental Health Summit, as well as youth advisory board members presenting at their school, informing the student body that their school has signed the Youth Mental Health Pledge. Outside of those, there's data to speak to as well. So, through the Youth Advisory Board, the different collaborations that we've gone through in just 2 short months, we've been able to provide 10 plus hours of training to date. Like I said, we have 23 youth leaders from 9 different schools and over 50 applications received. With the training, we do pre and post surveys to look at the effectiveness of the training. We had a 95% effectiveness scoring from survey results following our first leadership training. And following the Chat Safe workshop, 85% of members said that they'd be more likely to help a friend experience suicidal thoughts, as well as other significant increases in understanding how to respond when they come across dangerous content compared to pre-workshop data. We have 2 senior schools currently signed onto the Youth Mental Health Pledge, as well as 2 senior schools with established school health promotion committees, with several more working to implement them. So that's just some of the momentum that we've gained. And in terms of what we're learning from these short, quick months is a few things. So first of which, what's working, the youth voice has matured. We've seen young people stepping into their role and being more keen to take up opportunities. engagement has definitely been increased through stipends, wellness checks, mentorship, and larger breaks. One of the key insights from our working group was that we were meeting too often. Um, with that, some challenges that we're addressing is young people in school are busy, and scheduling flexibility around school and extracurriculars, creating micro roles for quieter members, and expanding beyond schools to community-based youth. So with that, I just wanted to provide some brief context for what the remainder of the term would look like, and even beyond. And so, in 2025, at the top of the year, we're looking to do more training and more conversations. As I had mentioned before, one of our big focuses is on legislation, and I'm sure Dr. Dan will touch on this tomorrow. There have been a lot of findings from our legislation interviews, and one of the big findings is that there's a big disconnect on young people's viewpoints and parents' viewpoints. And so our goal is to train youth advisory board members in restorative circle practices, so that they're able to, at PTA meetings, at assemblies, to hold restorative circles between students and parents to bring together those conversations and get a better understanding of each side's concerns on youth legislation. Anti-Stigma Month build-up, so looking to do a lot of lead-up events in schools, communities around awareness and campaigns. More media expansion. So we actually are looking to record our own podcast. I think our first episode launched today, as well as many other more radio interviews and those sort of things. And then last but not least, ensuring that school health promotion committees are activated, implemented, and fully rolling by 2027. So with that, I just wanted to thank again the Bermuda Mental Health Foundation for putting on a conference like this for us to be able to show some of the work that's been going on, to the Ministry of Health, to Bermuda College, the Bermuda College Foundation, to the Mirrors Program, to Pair Forward, and last but not least, our 23 incredible youth leaders. And for those of you who are wanting to stay in touch, to stay updated, to listen to our podcast, this QR code is linked to all of our socials. We're on Instagram, Facebook, and TikTok, as well as Spotify. And I just really wanted this presentation to have a certain impact in those of you with youth-centered programs, or really any program that's centered around serving a population, and just looking at, number one, how can you stay abreast of best practices and ensure that the decisions that are coming out of these programs are actually influenced by the population that you're looking to serve. And so with that, I just wanted to thank you all for tuning in, and I'll hand it back over to the moderator.
Oh my goodness. Wait, don't go nowhere. Don't go nowhere. Listen, that was so good. I'm so super impressed. I'm excited because, again, I remember when, the foundation was out doing school tours and really trying to tap into the youth, and these programs and what you're describing literally did not exist. So this is just educational awareness for me. I'm sure everyone that watched that, I'm excited to put this up so people can know exactly what is out there and what the youth leadership is doing in Bermuda. But before you do go, I actually have a question. It was interesting many years ago. I shouldn't say a few. We did a school tour. The foundation did a school tour. We went to many different schools. We talked about, mental health, awareness, stigma, the whole 9 yards. One of the things I found out years ago is that generation, or I guess what would be your generation, they were more in tune with mental wellness, mental health, right? So I would be in the audience and ask kids if they know what it was, and kids are like, "Oh yeah, I have a counselor. My mom has a therapist." So it was just so refreshing to kind of hear that generation was starting to be more accepted. I wonder what you're experiencing now as you're out in the community talking to youth. So this would have been like, I guess, 10 years from that. Do you find that the youth is more accepting to mental health awareness, coping mechanisms, skills, or do you still see there's a bit of delay? I'm sure it's better than my generation and even the generation before, because the generation before me, they were like, mental health, we don't, that's just for crazy people. My generation started coming around to the fact that there was something more, some chemical imbalances, but I'm seeing the next generation, from my experience, was more open to these concepts, these words. So I'm curious your feedback with that.
Yeah, I would definitely agree to a certain extent that the young people that we're coming in contact with today are ready to just talk about mental health, whether it's their own mental health. We've seen a lot of enthusiasm and young people getting involved with this initiative. I think the only piece that is still a struggle is the fact that they still have to navigate in a climate and in an environment that isn't ready to have these conversations outside of youth themselves. And so when it comes to the conversations in the wider community, whether it's with young people to their parents, whether it's young people in their workplaces, or just the broader community, there still really is a big stigma around mental health. So I think that the piece that you touched on, where they're more open to talk about it within their circles, is definitely encouraging, because we can sort of use that momentum to sort of blossom it into the wider community.
It's so interesting to see the generational transitions and gaps, as you said. They're more open to talk about it amongst themselves. That's great, but like you said, you got to bring it up to your mom, your dad, other people, older people that are in power and positions. And I remember, again, when I was younger, and I kept saying, when I get older, I would run this like this, so I will make sure that this happens, and so a lot of my generation is now in leadership positions. So hopefully, these are the types of questions and feedback that I think is going to continue to change and propel things. So again, I want to commend you and your entire team for what you guys are doing, and the stake you're putting in the ground, and a focus, because I think that mentally healthy children become mentally healthy adults, right? And mentally unhealthy children become these mentally unhealthy adults that we have to wrangle, so not necessarily wrangle, not in that way, but I mean, we have to take care of, and it's best to start, while they're young, to give them the coping skills. It's okay not to be okay. We're all a one step away, half a step for some of us, away from requiring and needing mental health support. So listen, continue. I want to encourage you. The foundation supports you and your organization. Please connect with us post-event. We would love to get more involved with your initiatives, especially around mental health conferences for the youth and the like, and just want to kind of wrap you up with some love and appreciation. Thank you so much for joining us today, okay?
Thank you for having me.
Okay, awesome. So everybody, we have reached the end of the day, and I would like to brag and say that we did it on time. Burn, burn, burn. Listen, if you have enjoyed yourself today, please make sure you communicate that. And I hope that we're going to see all of you guys, the ones that are in Bermuda, in person tomorrow. It's been such a pleasure to even get some personal DMs for people that are out of the country that's been tuning in, that have appreciated these conversations. Thank you to all of the speakers today. And I hope that you guys find value, because these speakers didn't just come together. They volunteered their time. They took off of their day-to-day schedules to deliver this information to you, for you, to support you, to educate you, to make you aware. And so we want to definitely shine a light on them, their businesses, and what they're doing in the community. Also, another thank you to our sponsors, the Ministry of Health, SCARS. Oh, there you go. They see, look at my production guy back here. Yes, yes, yes. So this is a list of some of the speakers that have been involved, the sponsors that have been involved, and we just could not thank you guys enough to, because without your commitment to the foundation and to Bermuda, to Bermuda's mental health, we would not be able to do what we are doing. So we have reached the end of the day. As I mentioned, tomorrow We will be at BUEI, doors open, registration and check-in starts at 9:30. So we'll see you there. And I also want to mention that our walk that we recently had this Saturday, we have the 2026 date. So I want you guys to save that date. We're going to plop that on the screen once I get done here, but it's October 10th of 2026. Hopefully we have better weather this upcoming year. But guys, again, it's been a pleasure. An absolute pleasure to host today. Tomorrow, I'm passing the baton over to Power Girl Trina, who always keeps us energetic and laughing. And again, thank you so much on behalf of the Bermuda Mental Health Foundation, all of our partners and sponsors. You guys have a fantastic evening.
Dame un guerrero. ¿Un qué? Un guerrero. ¿Un qué? ¿Un qué? Un guerrero.